This global call to action launched on Tuesday, the 21st of March, with leaders meeting in Washington and subsequent satellite events all over the world. I'm delighted today to be joined here by the Minister, the Honourable Minister, by UNICEF's Deputy Representative Jasper Müller, by USAID Mission Director Kate Crawford, and by Dr. Jude Comer, the Health Pool Fund Medical Advisor for the HDF in South Sudan. We will have remarks from each panel member, and then we open up for questions, and we'll have a couple of refreshments at the end. Every 6 seconds, a pregnant woman, newborn baby or child dies somewhere in the world. Most 5 million children under 5 die every year currently. Let me repeat that. Every year, 5 million children under the age of 5 die every year. Worse still, the maternal mortality ratio is stagnating and even reversing in many countries. So the time to renew our efforts is now. Progress in maternal, child and survival will not be made with one single intervention. It requires us to build a strong foundation with primary healthcare systems that integrate services, including sexual and reproductive health and rights, gender equality, nutrition and WASH, across a lifetime of beneficiaries. This must be led by the government of South Sudan, and I'm absolutely delighted to have the Minister here today with us. The government of South Sudan's National Development Plan commits to improving access to health services to address child and maternal health issues. The health stakeholders in South Sudan, and you have some of them here on the panel, support the government in delivering its National Development Plan. The UK government is committed to supporting efforts to end preventable deaths of mothers, babies and children by 2030. This is a key UK international development strategy priority. And on Tuesday, our Minister for Africa and our Development Minister, Minister Andrew Mitchell, has taken the role as the UK Ministerial Champion for ending preventable deaths. We are also launching a new UK global flagship programme on ending preventable death to provide technical and strategic support to 11 flagship countries, and South Sudan is one of our priority countries. Through our Health Pool Fund in South Sudan, a programme supported by the UK, USAID, Canada, Sweden, the EU and Gavi, in partnership with the Ministry of Health, we have collectively helped to drive progress in South Sudan in 2020 in 10 years' time, and that is even surpassing the National Health Sector Strategic Plan goal of 60%. So some really important progress, but we will hear from our panel members, there's also some significant challenges we still need to overcome here in South Sudan. And I want to quickly pause so we can see a quick video from Minister Mitchell addressing the global call to action.
Thank you to all partners here for energising the global fight against child and maternal deaths. Despite global goals and widespread efforts, a pregnant woman, newborn baby or child dies every 6 seconds. The UK government and I, as the UK's Ending Preventable Deaths Ministerial Champion, remain committed to working with everyone who shares our wish to end preventable deaths. Progress has been blown off course by the pandemic and Putin's war, but solutions are all around us. We must sharpen our focus on 3 things. First, equity. We know these preventable deaths disproportionately affect poor and marginalised groups and are fuelled by conflict and instability. We must listen to and champion the needs of marginalised communities. We must support them to hold their leaders to account, so that regardless of where people live,
I'm really happy here today to host all of you at this important occasion and to discuss the ongoing issues around the health of mothers and babies in South Sudan. We recognize and appreciate efforts put forward by FCDO, by USAID and all partners in organizing today's press conference. In these 10 years, since the global call for action was made, donor partners, governments, and the UN, as well as other stakeholders all over the world, have come together, driving this agenda forward with commendable efforts. However, as we heard also from a distinguished minister from the UK, progress continues to be evidently slow. Globally, 5 million under 5 children die each year, and nearly half of those are newborns and are mostly dying from preventable causes. Around the world, maternal mortality rates continue to either stagnate or are increasing in some parts of the world. In South Sudan, while we see some progress, for example in the impressive increases in women giving birth in the presence of a skilled health practitioner or in a health facility, we are still seeing 1 in 10 children dying before their 5th birthday, with a concentration of these deaths in the first month or the first year of life. Additionally, more than 1,150 mothers per 100,000 live births die due to pregnancy-related causes, which is one of the highest rates in the world. As you may all know, many factors in South Sudan contribute to these alarming maternal and child survival rates, including climate-induced recurrent shocks such as flooding, drought, poverty, and conflict. On this occasion of the 10th anniversary of Maternal and Child Survival Call to Action, there is indeed need, as Andrew was saying, to reinvigorate our collective actions for strengthening the primary healthcare system and adopt an integrated approach that looks beyond just clinical healthcare, to also ensure that it includes aspects of nutrition, water and sanitation, hygiene, gender-based violence, education, and women's empowerment. Allow me at this point to appreciate the government of South Sudan for developing the revitalized National Development Strategy, which has brought an opportunity to, I quote, consolidate peace and stabilize the economy. This strategy is aligned to the 2030 Agenda for Sustainable Development and expresses national aspirations for South Sudan to transition from a high dependency on humanitarian aid to a development path using the humanitarian development peace nexus approach. Our collective action, strong partnership, and collaboration are instrumental in successful implementation and realization of results from this strategy. We would also like to recognize and commend the government of South Sudan for being here today with us, an expression of their continued commitment to putting under the spotlight the urgent need to accelerate progress towards ending preventable child and maternal death. This is an important and meaningful step in turning around the negative trends and indicators for child and maternal mortality. As we sit here today, I wish to reconfirm our strong commitment and with our dependable partners here with government as well as donors to reinforce UNICEF's commitment to work with government of South Sudan and all health sector stakeholders, including key health sector donors like the World Bank, FCDO, USAID, and others, to realize and protect the rights of all women and children in South Sudan. Ensuring that they not only survive through pregnancies, childbirth, and the early years of life, but can also thrive and develop in life. Thank you for your attention.
I'm very glad to see our parliamentarians here. Jasper, Hamida, thank you for hosting us, and of course my colleague from FCDO, Andre, who has been not only here in South Sudan, but globally on the road to improving the health care of mothers and children. So it's a real pleasure. I was actually at the call to action 10 years ago. I am coming from USAID's Global Maternal Child Health and Nutrition Office. So I want to say that, not to repeat my colleagues' comments, but incredible incredible achievements have been made in the last 10 years. And really this whole initiative was to revitalize political attention to the needs and the priority that we all have to place on mothers and children. Today, I take this opportunity to, refocus our attention on the need here in South Sudan. This sort of past decade collective commitment has really made some unbelievable gains across the globe. African countries have lagged behind in some cases, although you do have some outstanding performers too, like Rwanda or Senegal, which look to be on target to pass their SDG goals. So we do have models. As Andre and the minister said, we do know what to do. It's a question of sort of political will, organization, and investment. South Sudan has seen some positive gains, as Andre outlined, but the situation remains quite dire for children and mothers in this country. As Jasper noted, it has among the highest maternal mortality rates in the world, and 1 in 10 children die before their 5th birthday. Most all of these are from easily preventable diseases. Right now, the country has experienced a serious measles outbreak in some 62 counties over 10 states. Measles, combined with poor nutrition, is killing children in this country at an incredible rate. And the measles burden in South Sudan, you don't see it at this level these days in many countries, but really what it speaks to is not only the instability here, but also the weakness of national and state immunization systems, which are critical to ensuring that children receive their childhood vaccines. In addition to disease and childbirth risks in this country, the egregious levels of gender-based violence that women and girls are subjected to and have been for a long time leaves them brutalized and traumatized. Healthy families depend on a healthy mother and an educated mother. And we work in partnership with both FCDO, the government, and UNICEF to improve female literacy, to provide quality antenatal and delivery services, to ensure that life-saving drugs and medicines are available to those who need them, to increase the use of family planning for healthy birth spacing, and to provide the range of critical childhood nutrition, immunization, and healthcare services all children need to survive and to thrive. Maternal child health and nutrition remains a core component of USAID's long history in child survival. Like FCDO, South Sudan is a priority country for USAID in maternal and child survival. We've walked this partnership, with UNICEF probably since the 1970s. So UNICEF has been a long-standing partner, and FCDO, likewise, has also been a huge partner globally. We remain committed to improving the health of South Sudanese women and children, but I would say to our government partners that significant change will only come to this country through the commitment, leadership, and stewardship of the revitalized transition government of national unity. Preventing maternal and child health is possible, but sustained government investment in the people of South Sudan, in their security, in peace, and in stability is fundamental to changing the dynamics here. Healthy mothers, children, families are the future hope for this country, and I hope that the government continues and increases their work with us to ensure the well-being of all South Sudanese mothers and children. Thank you.
Giving me this opportunity to address this gathering. I must say South Sudan has come a long way in the struggle towards maternal and neonatal mortalities and morbidities. It has not been easy right from the time of independence, and of course to date, but tremendous fight and changes have been achieved. South Sudan has been marked and ranked by WHO as one of the countries globally with the highest maternal and neonatal mortality rates. The biggest contributing factors to this is none other than puerperal sepsis. We have bleeding after deliveries, unsafe abortions, eclampsia, obstructed labor, and many more. Some of these are preventable, however, others are not preventable. However, as partners, we are able to directly support in the implementation with support from the various donors. And I want to thank USAID, want to thank the Ministry of Health, want to thank UK8, and of course other UN agencies that we have also directly worked together with, such as UNICEF and many more. As partners, your support has gone a long way in reducing the maternal and mortality rates through provision of 24 hours maternal and neonatal child health services in government-supported health facilities. Previously, at the onset of the program, it was not easy to ensure that 24-hour services were delivered. But as I speak now, some of the PHCCs have now picked up and are able to provide these services. And that means we have an opportunity to reach mothers who present to the facilities for care. Referral has been one of the biggest challenges in this country, and including logistics. But however, we've come also a long way with the support that you've provided to us as partners. Majority of the partners were able to procure ambulances, which has supported in the referral of complicated cases from lower level to a higher level where they can be able to access CEMOC or BMOC services, say from PHCU level to PHCC or to county hospitals. We were able to promote routine antenatal care services, including family planning and other sexual reproductive health services that has immensely contributed to the fight towards maternal and neonatal mortalities. Through your funding, a lot of capacity opportunities were supported, were provided to the healthcare workers in this area of maternal and child health. The signal functions, both BMOC and CMOC, had been a mess, but as we speak, these are picked up, and so far, so good. The staffs have been previously demotivated, but when you came on board, there was additional incentivization that is being provided to them in addition to the government salaries, and this has ensured that they are always available to provide care to our mothers and children. The government of South Sudan came up with a community-based policy of what we call Bama Health Initiative. There was nobody to support this. We thank you for having come on board in supporting the BHI component, which is able to provide services at community level, including healthcare awareness sessions, in which we have a variety of trained Bama health workers that provide community treatments to children below 5 years on malaria, diarrhea, and pneumonia, which has been one of the greatest contributing mortalities in children below 5 years. WHO estimates in 2000 gives us a total of 1,730 mothers dying in 1,000. In 2017, the data we have through still WHO estimates talks about 1,150, and I'm glad one of the panelists also stated this figure. However, you can clearly see that from 2000 to 2017, the trend is not that significant. There is still a lot to be achieved. Now, when we talk about infant mortality rates, in 2011, we're talking of 67 deaths per 1,000 live births. In 2021, we're talking of 63.8 deaths per 1,000 live births. That range will definitely tell you that there is still a lot that deserves to be conducted to be able to achieve and ensure that we reduce these rates further and further. We can look at the situation that if there has been no support that is provided to ensure a contribution is done on this to reduce this, then I think the maternal mortality rate that we are talking of earlier on 2054 would be even a mess. Probably would be talking about a figure of more than 3,000. Now, the Ministry of Health, with their support, through supervision, and many more, have contributed as well immensely in ensuring that our healthcare workers do adhere to the policies that is regarding maternal and child health. Through supporting the partners, we've been moving together with them for supervisions. Cases that arise, they have always come on board swiftly to ensure they are immediately addressed.
Of the 10th anniversary of the Global Maternal and Child Survival Call to Action, on behalf of my colleague, the Minister of Health. South Sudan remains on the top of the world in terms of maternal death, estimated at 1,150 per 100,000 live births. This high maternal mortality is due to easily preventable and treatable causes, which includes infections, hemorrhages, and obstructed labor, among other top causes. Our cultures, manifested by early marriages and early childbearing rates, at 28% of those giving birth are under the age of 18, and gender-based violence remain the main drivers. While the Ministry of Health is struggling to improve maternal and newborn health outcomes as stipulated in the National Health Sector Policy and Strategy, major obstacles remain in its path. On behalf of the ministry, I give credit to our development partners for the continued support, for the progress reached so far in contributing to realization of the health sector vision. And on this note, I recognize immense contribution of the donor community, the World Bank, the Health Pool Fund, and the bilateral donors in filling the funding gap. Going forward, I call on all stakeholders to come together in supporting the ministry in strengthening the health system. The National Community Health Strategy and the Boma Health Initiative will also play an important role in our efforts to combat maternal